Now, our next speaker is Associate Professor Kung Yen Ying, Director of Traditional Medicine Department, TVGH. His topic is Traditional Medicine for Cancer, offering perspectives on how traditional healing practices can complement conventional treatment in a holistic cancer care model. Please welcome Associate Professor Kung to the stage.
Okay, it's my great honor to present the traditional medicine for cancer in this section. Okay, this is my outline. Okay, this version is not updated. Okay, never mind. Okay, first of all, I must briefly review the traditional medicine because most doctor I think is the Western medicine, so it's not familiar with the traditional medicine. Traditional medicine is very popular among the patient or not the doctor because they focus on the patient response to the disease. So it's more focused on the natural healing process of the patient. So it's very popular among the patient. And the traditional medicine is classified to the 5 different categories. The first one we call the alternative medical system. It means this system have the diagnosis theory and the treatment process. And among these, the traditional Chinese medicine is belong to this part. As I know, the Vietnam also have is the traditional medicine. It is very similar to the traditional Chinese medicine. So the therapeutic strategy of the traditional Chinese medicine is to modulate a special response of the patient and to get a new balance with the human body. They use the several modality. The first one is the acupuncture. If your energy is enough, you can use the acupuncture to adjust the imbalanced energy status. And if your energy is not enough in your body, you can use the mosbastrin to enhance your energy in your body. And the third, if your body condition have the biomedical disturbance, then you must add some herbal medicine to adjust your condition. And in the recovery stage of the disease, you use it's called Qigong. Qigong is a kind of exercise or to enhance your body energy. Or another one is called Tuina. It's just like a massage or to recover your whole body status. So the principle, sorry, because they not update the style. The update style have the more competence evidence from our study. This is the old style. So some message miss in the list side. So I do my best. I try use my verbal presentation. Okay. The principle of tradition in the cancer therapy, the first one is a holistic approach. It balances the yin and yang and the qi and bra in the body. The next, the principle traditional in cancer treatment is the strengthening the immune system. This is very important for cancer treatment, adjuvant therapy. And when the patient receives the chemotherapy or radiotherapy, they usually produce the inflammatory products or therapeutic waste in your body. So traditional medicine have some special method to remove the toxin in the patient body. So usually patient will feel less fatigue and more spirit. And the next one of the principal traditional method in cancer treatment is the regulation the blood circulation. What is this means? Because some cancer patient, the cancer cell is in the status of hypoxia. Hypoxia is very resistant to the radiotherapy or even the chemotherapy. So some special traditional medicine method can regulate the blood circulation in the hypoxia cancer cell. So it's more sensitive to the radiotherapy or chemotherapy. Okay, and as we know, cancer have the many characters. So the traditional medicine, the strategy is because traditional medicine is not so strong. So they must use the many kind of the modality to inhibit. Sorry. Okay. And the traditional contribute to cancer treatment. We hope the three purposes. One is to prolong the disease-free survival period. If we can achieve this, this is the best one. But if we cannot, then we reduce the treatment side effect. And another purpose is improve the quality of life. Okay, this is the evidence, the prolonged disease-free survival of the cancer patient from the big data from the National Health Insurance of Taiwan. We can see the upper part is the Western medicine combined with the traditional medicine. So you can see lung cancer, colon cancer, or advanced breast cancer. If you combine with the traditional medicine, the life survival is better. This is a case at my clinic. This 40 years female patient with the lung adenocarcinoma with brain metastasis. Of course, she received a surgical resection and with the gamma knife destroyed the brain metastatic tumor. And the tumor cell showed the EGFR mutation. So he received a target therapy. And this patient, after Western medicine treatment, she come my clinic with the traditional Chinese medicine and cupping at a special point, or just like show here. And now she is 55 years old. Is also the disease-free survival. And he used the kind of the Chinese herbal formula we call the 善种会煎汤. It's composed with the 15 herbal medicine. It's a formula. From the modern study, we can see this herbal formula can activate the cascade apoptosis process. So it's helpful for the disease control. And this is another study from National Yangming University campus. The lung cancer have one type has a KRAS mutation. And if we give this kind of patient with a special herbal medicine, we call a Ganoderma microspore. Modern name is Linzhi. So if we combine with this, we can see he can decrease, delay the resistance or loss or mutation treatment, and also have a synergy effect with combine these two treatments. Okay, the second purpose of traditional medicine for cancer therapy is to reduce the side effect. Or this is the most strong evidence show the acupuncture. You can stimulation this point we call the pericardium 6 meridian is a 内关. It's just 3 fingers from your wrist. This point can reduce the chemotherapy induced nausea and vomiting. In another study, we can see acupuncture can reduce the neuropathic pain in cancer patients. Or this is a randomized control study and use the auricle point. And they divided the three arms. The first arm is a real acupuncture. The middle arm is a sham. Sham means the point is not a point for the pain relief. And another is the control group. We can see the real auricle acupuncture can reduce the pain score in this kind of patient. And for the reduced side effect, another important is for the acupuncture can improve the gastroparalysis after tumor surgery. Because this is very important, many gastrointestinal tumor patients after operation, they usually have the gastroparalysis. They cause the patient very painful, discomfortable, and delay the discharge. So if we use acupuncture for this kind of patient, they can shorten the admission period. And so the many medical centers also observe this phenomenon. So this is a published paper on the e-clinical medicine. They use the prospective randomized control to study this phenomenon. We can see the red and green color is acupuncture on the different point, but these two different points is related to the gastrointestinal function. So we can see if you do the acupuncture, it really can shorten the duration of the admission. So this is a summary. We collect the literature indicate the traditional medicine can decrease the side effect of cancer treatment, such as the poor appetite, nausea, vomiting, poor sleep, fatigue, and cancer pain, dry mouth, and so on. So this is another study show the patient with the head and neck cancer. They use after radiotherapy treatment. We combine with acupuncture. After 1 month, we can see it can significant improve the dry mouth better than the sham acupuncture or just the oral hygiene treatment. And another Chinese herbal medicine, we call it astragalus. The Mandarin name is Huangqi. It can improve the hematopoietic function. This is an animal study. We can see the second pink color is the cell we give the cyclophosphamide, and the blue color is the cyclophosphamide combined with the Huangqi or astragalus. We can see the white count is preserved in this condition. So if cancer patient after chemotherapy have the low white count, we can use the astragalus improve his white count. Okay, the next part I will talk about how to integrating traditional medicine with the modern oncology. This Taipei Veteran General Hospital, we build up outpatient breast cancer treatment. One is the Western medicine doctor, and one is a traditional medicine doctor. They see the one breast cancer patient, and the breast cancer patient satisfied is very good. We can see the patient number increase over year. We also cooperate with the nutrition department. For the inpatient, if the patient have the radiotherapy induced oral mucosa damage, we use crab and some Chinese herbal medicine to reduce this side effect. And for the patient with the diarrhea or poor appetite, we use the special herbal medicine with the chicken to improve his nutrition and appetite and decrease the diarrhea. So every stage of the cancer, maybe traditional medicine play a supporting role. For example, after the operation, we can use some increase the energy herbal medicine. And for the radiotherapy or chemotherapy, we can use some traditional medicine to reduce the side effect. And for the terminal stage, also traditional medicine can improve the quality of life of patient. And this is real data at our hospital from the 2023 and 2024. We can see the overall, the quality of life is better at the traditional medicine intervention, the blue color. Okay. And we do the different cancer analysis. We can see the gastrointestinal cancer is the better effect with the traditional medicine intervention. Okay, this is my conclusion. Traditional medicine as a valuable complementary therapy in cancer treatment. And maybe we can integrate the modern oncology with the traditional medicine for better care of the patient with cancer. Thank you.